Our next speaker is from Central Manchester NHS Foundation Trust, and a lot of you will know Simon Walsh. Simon's going to talk to us about top 10 hints for procurement, hints and tips for procurement. And Simon is the chair of the Healthcare Supply Association. He's been in procurement for 28 years, so a wealth of experience. His team are here presenting, actually, and I've already been to speak to them. Because what struck me was that this is quite a big team. The team's got 50 people in it, and it covers accounts payable as well. But actually what they can demonstrate is that that team are really adding value to patients and in terms of helping the hospital to keep on track with its finances. So well worth having a discussion with them. And Simon, I'll hand over to you because it'd be interesting on the back of John's presentation to see your top hints and tips about how we can crack this challenge nationally and locally. So over to Simon.
Hello everybody, good morning. Just to start us off here, just to get a feel for the audience, because usually when you speak, you sort of look at the delegate list and, you know, sort of size up the audience, particularly when it comes to speaking to SMEs, because you're always going to get a feel for the anger in the room, for the enthusiasm in the room. And I've spoke to quite a few SME audiences recently, and there's been a real anger in the room. A real anger running through. So I think just a few questions really. Who is from an SME? If you can just put your hands up, and if people just want to scan each other just to get a feel for who's in and who isn't. Thank you. Who's from NHS Procurement? Excellent. And from the SMEs, who's supplying the NHS at the moment? And as always, who wants to supply the NHS? Thank you very much. A nice mixed audience and a nice group, so that's really good. I became the chairman of the Healthcare Supply Association in April 2013, which is the, I suppose, the networking professional group for NHS procurement staff. I've spoken at about 24 events over those 20 months, and that's ranged from the Chinese Business Association in Manchester, where I won the raffle, which was a 20-kilogram sack of rice. And apparently the rice is the finest rice you can have. It's absolutely, you know, envied by everybody in the room. So 11:30, walking from the Wing It restaurant in Manchester with a sack of rice on my back. The Manchester BME Business Association, where at the end of the evening I was offered a 3 massage, and ranging to a few weeks ago speaking in number 10 Downing Street, which was absolutely fantastic. And I think I have to say thank you to the AHSN for organising such a professional event, for all the passion and energy, but all the mechanics of the event. Because when I went to Downing Street, we had to rearrange the room ourselves. The laptop was very, very dated. The guy from the IT team said he had a prior engagement with the National Security Council at 10 o'clock, so he wouldn't stay. And there were no biscuits, and you had to help yourself to everything. And the teacups were plain NHS public sector ware. No crest, no nothing. So I have to say, well done to the AHSN for such a good event. I make no apology for being a promotional ambassador for NHS procurement. So if you want me to stand here and say NHS procurement, obstinate, doesn't work, significant problems, etc., etc., I can't do that. But what I can do is recognise the good within NHS procurement, but also recognise the need for improvement, particularly when it comes to access and support to SMEs. So, using my hat as head of procurement for Central Manchester, which I've been in place now since 2003, just thinking about our approach to supporting SMEs, and perhaps thinking about how we can pick a few of those themes from our approach, which might be as useful for you as NHS procurement staff, but more importantly for you as SMEs and hopefully potential suppliers to the NHS. I think the first thing to say is For a procurement team to support and understand SMEs, it has to support and develop and understand itself. Developed procurement teams who have a clear strategy, well-resourced, well-supported, qualified staff, commercially aware, I think they're going to be more likely to understand the potential for working with the small, medium enterprise sector. We have many of those teams across the NHS, but we also have many teams who lack the support, lack the profile, lack the resource and the initiative that is needed to work in partnership on this agenda. I think secondly for us at Central Manchester, and Central Manchester, we're part of Greater Manchester AHSN, work very closely with our colleagues at North West Coast. Secondly for us has been absolutely top level, top of the house support from the chairman, Peter Mount, the chief executive, Sir Mike Deegan, the board. Importantly for us, every foundation trust has a council of governors. And they are individuals who are actually interested in what the trust does, the services it provides, how it spends its money. And we've had a really active council of governors looking at these issues, inquiring, supporting, questioning. A lot of the questions we can't give the answer which we want, but we can explain to them how we spend our money and how we employ various strategies to support the trust. And I think that's an absolute key, really, for NHS procurement teams, certainly those in foundation trusts, but equally those in non-foundation trusts, to get that ownership and engagement of those senior people, that level of visibility and expectation, that constant drumbeat of having to report every year how much do we spend as a percentage with SMEs. And once you've captured that, and once you've climbed that mountain of data, then it's a maintenance task rather than the ongoing challenge to manipulate that information. We've got a strong payment performance at Central Manchester. Cash counts. We're committed to 95% payment within 30 days. For SMEs, we're committed for 80% by invoice value to be paid within 10 days. That's a board-level commitment. It's a challenging commitment in an increasingly tight cash flow environment, but it's a top-level commitment. And despite all the challenges of the financial position 2014-15, that commitment has not been discarded. Our board have kept to that commitment. SMEs paid within 10 working days of receipt of a valid invoice subject to satisfactory correlation of all appropriate goods. Invoice and purchase order matching invoice at all stages. Quantity, unit of issue, case quantity, part number, carriage clear on invoice. All that, if you achieve all that, no, slight exaggeration, you'll get paid within 10 days. So, a clear supplier access policy. Absolutely clear. Central Manchester has that policy. Aintree Hospitals has that policy. A very simple A4 with the 10 do's and the 10 don'ts. Nothing fancy. Some trusts have 20-page supplier representative policies. Very simple access policy. And then finally for us, what it all means for the trust. And it's a simple message, and we can't get away from this. But at the end of the day, for Central Manchester, every 40k identified on savings on non-pay helps to support and embed a post, whether it be a nursing post, whether it be an admin post, whatever. Every 40k on average supports that agenda. And that agenda has been embraced by our union colleagues within Central Manchester. Walking down the corridor outside the Everett's restaurant, Unison representative came up to me, started to kiss me. He was slightly worried, and she said, thank you. This is an important agenda. We fully support it. Let's get behind it. I said, thank you, Peggy, but you can take your tongue away from your cheek and move on. And SMEs will face the same challenges as all suppliers. Set out in better value, better care, better procurement, that zero inflation environment. Yes, it's a broad brush tool. Yes, it's applied and there's all sorts of issues and every supplier can come up with some excuse, but there's some cost pressure there that is unique and better than other. But the expectation is clear, the budgets are set accordingly, and the challenge is thrown down to support that policy. And I have to say, and I'm sure John will agree with me, you know, up until recently, many of us, including Central Manchester, were in a cost plus RPI, 1st of April, 1st of January, price revision environment. Many existing suppliers assumed every year that those prices could increase. And yes, CPI, RPI. Anybody heard of HSCI? Health Service Cost Index. The NHS has its own denoter of inflation, HSCI. So zero inflation is here for all suppliers, and it's there for SMEs. And interestingly, as we've applied that policy, it's SMEs who have responded in a real positive, engaged way. I think this past year we've had about 90 face-to-face meetings around this issue, and it's the SME sector, all credit to that sector, which has responded positively to the zero inflation agenda. And I can come up with probably 10 reasons why you wouldn't apply zero inflation. I can come up with another 90 why you would want to and why you should. It's broad brush, but it works. Data, data, data. And we get back to the analysis of non-pay spend. I think the first thing to say is, and I say this to my colleagues in NHS procurement teams, and I know they're sat there thinking, it's fine for Central Manchester, 50 plus staff, etc., etc. You've got to control and command that data. We've got to know our supplier base, and we've got to understand the geographical location of that supplier base. Now, the Greater Manchester AHSN has commissioned a piece of work for all trust members to feed their data and to come up with the same level of analysis across GM as we've been producing at Central Manchester. We've got to command that data. And if the AHSN's quite rightly, and if individual trusts have ambitions to increase jobs locally, support local suppliers, various percentages around the amount of money going in the Greater Manchester economy, we've got to have a baseline in order to judge where we are. And then as you develop your data intensity and your skills, you get the geeks and the techies in your team who like to start playing around with software, doing the heat maps, seeing where the spend is across Greater Manchester, doing the graphs around the spend across the northwest, starting to see the blobs, where the heat is, where the intensity is. And then they get more refined and they move on, and they start then to produce graphs, which you start to worry about. Because you see a line dipping for Greater Manchester. And despite the overall cash figure having increased, you start to see the rest of the spend through better analysis, through better data capture, that's increased. So you start to see graphs and slides that start to register on your radar. Now, I tried to present this slide in the presentation in Downing Street, and the civil servants censored it. We said, I'm not sure if that's an appropriate slide to show, and I'm not sure if that's in keeping with the message. I said, that's fine, you're in charge, up to you. But, you know, once you start producing data, you're making yourself visible. Procurement teams are stripping themselves naked to SMEs, to the supplier sector, and we're coming under increasing question about how we spend our money. As I say, the cash figure for Greater Manchester increased. The proportion decreased for GM. The overall figure increased. You start to analyse and ask the questions, and I can come up with 100 reasons why that's the case, but you've got to be prepared to be visible and transparent and start the dialogue and engage in that discussion. So, the top 9 tips. We're only going to do 9 at this stage for a reason. Always very reluctant to give tips to suppliers. And I think it's because when I met Lord Young, who's the Prime Minister's enterprise advisor, he asked me about my career and what I'd done in my life and how I was and various things. And he said to me, he said, you know, not being rude, but you're exactly the kind of person Margaret would have disliked. I said, thank you, Lord Young. I said, I'm not sure if that's a compliment or a criticism. He said, yes. He said, you've worked all your life in the public sector. You've never run a business. You've never had a failed business. You've never had a successful business. All your life you've spent in the public sector. And I sat there and, the room went quiet. And I thought, well, how do you respond to that? I said, he's right. And, Margaret might have felt that. But, at the end of the day, this is my experience. This is what you share. So I will break the habit of not giving tips and give 9 to start with. And if they're a bit mother than apple pie, then please, forgive me. But I think this is a very basic issue. Let's not overcomplicate it. I think firstly for me, any supplier, whether it be SME, whether it be large supplier, that ability to speak to us as procurement teams with confidence and to make sure that worries and concerns are expressed and right through that purchasing process. The last thing we want as procurement staff is things bubbling away, do we? We want things out in the open. And if there's worries about product, price, supply, whatever, let's get them discussed early doors as part of a dialogue. Secondly, and I think quite an important issue, you've got to gear yourself up to supply the NHS. It's a serious business. Central Manchester, £350 million of goods, equipment, materials and services, 500,000 stock items coming in from NHS supply chain, and thank you for that, David. Thank you for what you do for us. 70,000 non-stock orders, 400,000 non-stock lines. It's big business. 1 billion turnover just short of. Take it seriously, and to find that niche and that slot within supplying an NHS organisation is a serious thing to do. I think thirdly for me, act corporately at all times as an SME. Your infrastructures might be lean, you might not have legions of people, but make sure you're consistent in your messages and make sure that that's reciprocated from the procurement team that you're dealing with. Challenge and question procurement. Rajan Setty's in the room from Blackpool Hospitals. He loves a good argument. He loves a good debate. Procurement people in general will want to be challenged. The days of an NHS supplies officer, NHS procurement leader not being challenged and not being visible or transparent have gone, if they ever existed in the way that sometimes it's created. So be prepared to challenge and question procurement. And I think it's fair to say for those procurement staff in the room, there's a massive trend now, isn't there, towards increasing challenge, whether it be challenge of contract awards, questioning at Alcatel. Everybody wants to know more than perhaps we did in the past. And for most of my career, and I think certainly for John's career, we sheltered under commercial and in confidence, didn't we, John? Everything we had, commercial and in confidence, you can't have it. It's commercial and in confidence. And that's been shattered by all sorts of agendas. It sounds a bit trite, but I think it's true. You've got to have something unique. You've got to find and explain to us and get over to us as procurement professionals, but not as clinical people or not as experts on IT and mobile telephony. You've got to explain to us your USP. You've no right to supply the NHS. You've got to get over why you should supply the NHS. Find that USP, that unique selling point that we can grasp at and hopefully take forward. I think I'm up to 6 now. Know your rights. This is the most controversial one for our procurement professionals. SMEs, you have every right to be dealt with professionally, to be paid promptly, 30 days absolute minimum, and the law's moving in your favour, the government's introducing reforms. Certainly 10 days should be the ambition. But I hate to say it, but the Freedom of Information Act is there for you to use. And the eyes are going up in the room, quite rightly, amongst the procurement staff, because we're getting bombarded with FOI requests. When it first started, it was taxes and the cost of VIP visits. Now it's prices, contracts, all sorts of different things. But at the end of the day, the Freedom of Information Act is law. It's a statutory entitlement and responsibility. And believe you me, when I retire, I'll be sat there sending hundreds of FOIs. I'll be going on all these websites and having so much fun on freedom of information, I'm going to just enjoy it. I will be the person who bombards public organisations with those requests because you can't hide from it, we're under pressure to respond to it, and it's become an escalating issue within the organisations. Am I right? I think I am on the issue. And the FOI people is zealots. They've no recognition of workload or recognition of other responsibilities. If Joe Bloggs sat in his one-bed flat in Bracknell, has emailed the trust and wants to know how many staplers we purchased in 2013-14, that sad little man sat in his flat in Bracknell, on his internet, getting all these responses, he has a right to know. And he will find out, he will know, we will give him that information. I think as you develop your relationship with NHS procurement, inevitably you're going to have to revise your strategy. And at some stage, I think SMEs will get to a point through the purchasing process where they determine that the NHS or the particular NHS organisation is not for them. And when that happens, move on. If you're trying to supply catering to central Manchester hospitals, 95% of it is with Sodexo. Speak to Sodexo, speak to the City Council, who have in-house catering, speak to the university, who we talk to and work with. Revise your strategy. And if you can't supply central, the South Manchester, we have contacts across the patch. And if you're really desperate, you could perhaps try and supply Blackpool hospitals, but you'll never get past Regent. So there you are. I think national and regional ambitions, all the agendas on your side now. I think that's true, John, isn't it? There's a strong beat from government to support SMEs, the work of the AHSNs, the ambitions that they have around the agenda. I sort of thought at one stage this issue might go off the stage as things come and go on the stage of issues. I think it's probably here to stay. And I think irrespective of government, I think the agenda is now so embedded within the infrastructure of the public sector of the NHS that it's here to stay. And I think, and I probably don't need to say this to you, because if you're trying to supply anything, it must be a slog of a job, trying to build a market, build a customer base. I mean, even the basics of finding somewhere to park, having a little bag of change, making sure you're clean and tidy when you turn up, finding where you're going to, spending your money in Costa coffees and supporting PFI schemes, all that as a supplier to the NHS and as an SME. I'm sat there in my office, and my staff is sat there, and in most cases, you're coming to us. But you have all the preparation and everything to do to get to where you are. And, you know, you do, as SMEs in general, you set the standards of cleanliness. You tend to turn up clean and tidy. You prepare, and like most suppliers to the NHS, I mean, it's fair to say, you're professional, you're corporate, you do things. And if there's 4 of you in a room, if you have 4 people, you tend to be corporate and unified in your approach. Simon's rule of NHS procurement number 5, never negotiate with customers and procurement in the room. Because the customer and procurement will end up, there'll be a disagreement and something will happen and will break up the corporate nature of the debate. You will be patient, you will be understanding, I think you will reflect your strategy accordingly. And then finally, and I know I had to get it in because, I mean, you know, John sits with Dan Poulter. I went to see Dan Poulter a couple of years ago, nice office. John was sat there in the office, in the, you know, the little lounge area, asking Dan to get him papers. John was in charge. Dr. Dan, the Parliamentary Under-Secretary of State. I sense that John had got so close to the Minister that they were virtually together on this strategy. It was fantastic to see and really, really heartwarming. So, my final advice is, seize every opportunity to get your message across. Never apologise for NHS procurement, because there's nothing to apologise for. It's a fantastic service with some fantastic people. NHS procurement staff need to respond to that agenda, need to see SMEs not as a threat, not as a pain. And I've worked in offices, believe you me, where, you know, you said that SME's having a whinge again. That supplier's having a moan. They're going to go to the press. They're going to write to the boss. I think we've moved on from that agenda. But you, as potential suppliers, like I've tried to do in the HCSA role, seize every opportunity, whether it be talking to the Chinese Business Association and walking through Manchester with a sack of rice on your back at 11:30, whether it be the Business Association, whether it be the Continence Advisors, whether it be the Association of Sexual Health Workers in the NHS, hospital caterers, every opportunity for you to get your message across. And I've seized those opportunities, and I'm sure you will do. Finally, from my perspective, I think on behalf of the NHS procurement managers and their staff, a recognition that suppliers to the NHS pump those goods, equipment, materials and services into the system that delivers the healthcare and the services that support patient care. And suppliers to the NHS are no less a part of that partnership than any other. And you have an absolute right to be treated with respect, to be listened to be engaged, to be told no when it is no, but to be told yes when it is yes. And if you are an SME, you're looking to supply the NHS, I wish you every luck on that journey, and thank you to the AHSN for inviting me to speak. Thank you very much.